Hello and welcome to Aging Matters. This show is produced by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. I wanted to let you know that in honor of or recognition of National Crime Victim Rights Week, which is April 10th to the 16th, that our agency will be participating along with several other agencies in a resource fair at the Berkshire Mall. We will be at the Boscov's end of the mall on Saturday, April 16th from noon to 3. And why we're there, in addition to being the Crime Victims Week, is that tonight's show we wanted to focus on elder abuse. And our show then tonight is Elder Abuse. What is it and how can you help? And my guest this evening is Tina Weiss, and she is the Protective Services Supervisor with the Berks County Area Agency on Aging. So thank you, Tina. I appreciate your time tonight. Unfortunately, it's a topic that I guess many of us either try not to think about, or when we do, it kind of is a little scary and frightening. And so I think it's good for us to look at this. If it's nationally, that it's Crime Victims Rights Week, let's talk about that and really say what is, in our case, elder abuse. So let's talk with the basics. Let's start right there with what is abuse. There's all kinds of types, and I think some of us just think about certain types. So I want us to talk about some types, and then let's talk a little bit more about those types, and then give me some examples to help us understand that.
Okay. First, there is the physical abuse that I think people tend to think of first. And in addition to physical abuse, there's emotional abuse, which can take the form of yelling or intimidation or swearing at the older adult. There's caregiver neglect, self-neglect, in which an older adult is truly no longer able to care for themselves and meet their medical needs, their hygiene needs, their medication needs, managing medication, bill paying, that sort of thing. And also something that is increasingly on the rise is financial exploitation.
Okay, so I want to talk about a little bit about each of those areas. So let's start with, again, what you said, and I think that we all think when we think abuse, I think that's either comes to mind first because it's more, we read more about it maybe in general. So it's hard to also think about physical abuse in terms of the elderly. But let's talk about, give me some examples. What is physical abuse?
Physical abuse can take various forms and happen in various settings. And we see people both in their own homes in the communities as well as personal care homes, nursing homes, adult day programs. And the abuse can happen between family members. Sometimes what we see are domestic violence situations that have just continued throughout a couple's marriage, or maybe the person who historically had been the abuser is now care dependent and has now become the abused as the victim. The person who was the victim is now in the power role.
Okay.
It can be children who are overwhelmed or are just not equipped to cope with caregiving, who become abusive towards their parent. It may be in a facility setting or another resident of the facility, either because of a dementia diagnosis or an ongoing mental health issue, or just an altercation that escalates to hitting or pushing. And it can unfortunately sometimes be a staff person as well who is
and so the abuser. And the physical abuse could be something we think about, whether they hit somebody intentionally or just intentionally but out of emotion, and unintentionally. Or can it be something restraining?
It can be restraining. It can be pushing. Okay. Especially sometimes in a care setting where maybe two residents are confused and words are exchanged and things escalate to where one resident pushes another. And because of the frail condition of some of the individuals, they may fall as a result. Okay. It could be pinching. It could be, as you mentioned, the restraining of the individual.
Okay.
or locking them in a room when a caregiver leaves, if they're wandering.
Okay. So we have the physical, and then we also have emotional or verbal.
Emotional, verbal. Again,
Okay.
it can be yelling, it can be swearing at the person, it can be take the form of, I wish you would just die. And again, it's usually a caregiver who becomes overwhelmed with the situation. Again, it can be a spouse, a child, a hired caregiver.
And again, many times it's obviously coupled with many times over. So the situation comes out each day. For example, it might be helping somebody bathe. And that's something, a routine that we might have, but and an older adult may not want to do. So sometimes, and correct me if I'm wrong, then they may not want to do that, and every day we that caregiver has tried to go through that every day, and sometimes it mounts. So it could come out with the physical, or it could come out that yelling, please, we do this every day, shut up, just bathe, that kind of thing?
Yes,
Okay.
and in some situations it may be one sentinel incident that raises an alarm, or it can be a pattern of behavior that someone the reporter, whether it's a neighbor or a friend or a professional going into the home, sees an ongoing situation where people are belittling or yelling, or maybe they're seeing a progression where they see it once and they may think, oh, it's a bad day here.
Okay.
Mrs. Smith is a little short with her husband, but then over a period of time they see the behavior.
Can you give me an example then of the emotional, how verbal versus like emotional abuse? Is it not necessarily the words that are,
right?
I don't want to say abusive because it is.
Right. Sometimes people, in family situations especially, people may be loud and that's how they communicate. But how does the older person receive that? Are they cowering? Do they appear fearful of the person? Are they telling the individual, oh, I'm really scared of my daughter, I don't want to upset her, or I'd like to go to a facility, but I don't want to upset her.
Could it be like a threatening thing as well, such as, if you don't do this, you're going to go to a facility?
Yes,
I mean, could it be
yes,
something
yes.
that's kind of that harassment? When you said intimidation, that kind of was what I was thinking of when you said that word. Okay.
And many times we see emotional abuse hand in hand with the exploitation. If you don't give me your debit card, I'm going to put you in a home.
Okay.
If you don't put my name on the house,
Okay.
And oftentimes the threat does involve placement in a care setting.
So then let's go to the other one you mentioned, the financial exploitation. And you're saying we're seeing more of those?
Yes.
Okay.
Yes. And the exploitation can be a family member. Oftentimes when people think of exploitation, they think of an adult child who is taking advantage of the person, or we hear about contractors who are prey upon the elderly. One thing that comes to mind is the people who will come and pave your driveway.
Right.
They're in the neighborhood.
Take your money.
Right.
Okay.
But what we're also seeing increasingly is people who are functioning pretty well in their day-to-day life, but they fall prey to the lottery scams, some of the IRS scams that have been very rampant recently in Berks County. Dating websites are increasingly becoming sites where, as more older individuals are using the internet and becoming more internet savvy and using it as a social outlet, unfortunately they're being preyed upon.
Okay. And then, so the financial, and that's increasing, and then the neglect and the self-neglect. So let's start with the neglect.
Okay.
The neglect. For us to understand that.
And neglect by a caregiver can take a couple of different forms. Maybe they are not providing the care themselves, but they're also not willing to explore having help come into the home or look at placement. Again, a lot of times when we're dealing with caregiver neglect, there's an adult child or other relative who, because of circumstances, has returned to the home. They're now in a caregiver role, and maybe they're not equipped to be a caregiver. Maybe they don't know what's available to them. Maybe they don't like the options that are available to them because they're reliant upon mom or dad or their older relative's income. So they then don't take the steps that they need to ensure that the person has the care that they require. Maybe they leave the person for an extended period of time, and the person has a dementia that they're not able to either call for assistance should they need a rise, or if there's a fire, they're not able to exit on their own.
So it's care, but then that leads me to safety as well, that the person being safe.
Correct.
At the same time.
Correct.
Again, as an example of if they left for a period of time to do some errands and go out and meet friends, and we're leaving, mom or dad home, it could be a couple things. We might have locked them in the room, so we have that piece, and then not provide them with something during that period of time, such as a way to reach somebody or food or something.
Correct.
So it could be a couple.
Correct. Or maybe the person's not able to transfer on their own to get to the bathroom should they need to. And again, being able to access assistance in an emergency. That's one of the big concerns that we have with individuals being left alone for periods of time. Not only are they able to meet their physical needs during that window, but would they be able to deal with an emergency should it arise?
Okay. And then self-neglect.
Self-neglect is when the older individual is no longer able, due to a memory impairment, to do the things that they once did. Maybe they're not managing their medications appropriately. They have the money, but they're not paying their bills. And sometimes it's hard for people to differentiate between lifestyle choices versus someone who has crossed the line to self-neglect. Many times when we're looking at self-neglect cases, we're looking at historically how has the person behaved. Are they someone who always kept a nice home and maintained their home, and now over the last year or two has really started, not cleaning, not taking out the trash? Are they someone who went to the doctor and now they've missed their last 4 medical appointments? That sort of thing. Okay. Maybe, they were always neat about their personal hygiene, and now they're not bathing for weeks at a time. They're not changing their clothes.
And there's a difference there in terms of not just dementia, normal aging issues. This is something really more in depth.
Correct.
Okay. I think what we want to do now is I think we have a basic understanding of the different types of abuse when we're talking about that. And what do we do? That's the second half. How can I help? I think, people are so confused. People want to help. They don't know exactly how can I help. They're not sure what if I get involved? You have those folks who want to help but don't want to get involved, and how much involvement can I give? And how much do I feel confident in giving the info? Because I'm not sure that I have. Is it that person you just mentioned who, she used to dress nicely, but maybe her income changed and she can't afford, the nice things. So there's a lot of questions, I think, on people's minds about involving themselves, if they should recognize something. So how do we start? How do we begin to help?
I think a lot starts on, first of all, your own personal comfort level in approaching the person. Okay. Is this someone that you feel comfortable as a friend, a neighbor, a church member approaching and saying, it seems like maybe you're having some trouble, and talking to them to get just to gain a better understanding of what's going on. And again, not everybody's comfortable doing that, but if you do feel comfortable having that conversation with the individual, to do that.
And that could be on any of those abuses. Just
Correct.
because we were talking about the self-neglect, we might see signs of some physical things, or again, a loud noise and they cower perhaps, or some other things.
Or
It's all about
unexplained
that.
bruises,
Okay.
or and you may find that the person's just been experiencing some falls, and then you can certainly.
In which case they may need help.
Right, but they may need help anyway, just a different type of help.
Okay.
So, if you feel comfortable talking to the person and finding more information, that's a great place to start. And depending on what they tell you, you can offer to call our office with that person or
Okay.
to call on their behalf. Sometimes, our office does a lot of different things. We do information and referral in addition to protective services. So whether you call with the person or you call on behalf of the person, the intake staff will talk to you and ask you guided questions to determine, is this something that maybe they can just call the individual and offer them an assessment and offer information on some of the other services that we have to offer, or if they say, wow, this is really a concerning situation, and they do ultimately end up taking a report of need to refer to protective services. But they will elicit as much information from you as possible in order to help make that determination.
Okay. Give me a couple of ideas of some of the things that if I were calling the agency and they're going to ask me some questions, is there some things I should be prepared for that would help
Yes.
in making that
Yeah.
move forward? I mean, and I'm thinking of a couple of things when you said about the falls. I mean, maybe it was that the individual had medications that they didn't get filled, so they didn't take it, which led to this. And so maybe even that referral, I would say, hopefully encourage them to offer that, so they might be, as you said, other services and other programs. But if I am, what kinds of questions might I expect to be asked?
If you're calling, first and foremost, you're going to be asked some demographic questions. Basic questions: the person's name, their phone number, their address,
Okay.
their date of birth, or at least their approximate age. The questions start out fairly basic and,
Okay.
and easy. Depending on the reason for your call, the intake worker may, if you're just calling to make a referral, they may ask you how the person manages with bathing and dressing and grooming, how they manage with grocery shopping and getting to the doctor. If you're calling and thinking that the situation may involve elder abuse, they're going to ask questions about, well, how long do you think this has been going on?
Okay.
Is there one thing in particular that has caused you concern? Or is there a pattern of concerns that you see? And they'll start by asking you what the concerning situation is, but then they'll go into a series of questions. And as much information as you're able to provide, the more information is best, but if you don't know the answers to all the questions, that's okay.
Okay.
But they'll ask questions about, does the person have any functional limitations? Do they have trouble getting around? Do they have some forgetfulness? Have they been in the hospital lately? They'll ask if the person seems confused or if they seem fearful in their situation. They'll ask if they have a power of attorney or someone who's helping them with their financial and legal affairs.
Okay.
They'll ask who their doctor is if you have that information. If you don't, that's okay. And they'll walk through to ask questions that might prompt you to think of things that you wouldn't otherwise.
Like, now come to mention it, I saw this or I didn't see that. Okay, all right, all righty. I assume if we know other supports in terms of if they have family members or other people who may help, that you see them stop in once a week, or you can offer at least what information.
Yes.
Okay. All right.
Yes.
So, as much as the information that I know, it's not that I necessarily have all of the information. My hesitation might be the involvement piece of that. I really want to help my neighbor, and I kind of think this is happening, and I really want to call, and even maybe as you said, they want to sit with me, and together we can do it, and that's kind of even making me feel better. But where does it go from there? My name, I have to give you my name. How about, what do you want from me in terms of myself and my involvement, particularly from that point and maybe on from there?
Well, first and foremost, anyone who calls our agency and makes a report of need is confidential. We cannot disclose who we received the report from to anyone. Now, many times people have guesses. Sometimes they guess correctly, sometimes they're way off base, and we don't confirm or deny whether they're correct, but you may receive some fallout as an individual, but know that we haven't shared that information. People can be anonymous. However, it's really better if you're willing to give us your name and phone number in the event that the assigned worker has additional questions for you. Maybe they're having trouble getting into the person's home and just want to follow up, which door do they normally use, or I've been there 3 different times and no one's answered the door. Did she go to the hospital? Things like that. It's helpful if we have a name and a phone number to follow up should we need to. Certainly, we don't want to put anyone in a situation where they may be at risk for calling. When that's the reason why all the information is kept confidential. But it is helpful if we do have someone that we're able to follow up with. Now, that being said, we cannot provide any information even to the reporter as to the status of our investigation, the outcome of our investigation.
So I have to be comfortable knowing that I've done my part. That's how I can help, that I can provide you with my information, whether it's observation, whether it's in my discussion with the individual, and then offering as much as I have to make sure that you've got as much and a way to reach me, and knowing that you're going to keep it confidential, and I'm going to feel at least that I've been able to help. Okay. In the short period of time that we have, I guess we need to make sure that they have our contact information, so I'm going to ask for the slide that we have to be put on the screen now for us. Tina, why don't you tell us how we can call to report something we might suspect?
We do have people available 24 hours a day, 7 days a week to receive calls. We're in the office Monday through Friday, 8 a.m. to 5 p.m. After hours, holidays, and weekends, when you call our number, you'll receive an answering service. They'll take your name and phone number and ask the reason for your call. And within about 15 minutes, depending on where the on-call worker is, they'll be giving you a call back to take any information that you have to provide. We're also providing the Pennsylvania Department of Aging hotline, and that number actually routes the caller to the county that they are calling from. So that's another option for people who may not live in the Reading area.
So I'll just mention it one more time, that the Berks County Area Agency on Aging's phone number is 610-478-6500, and please give us a call. In one last quick 30 seconds wrap up, one thing you'd like to mention just to clarify or explain anything about elder abuse?
One very common misconception is that protective services always involves people being removed from their home. And that is biggest thing that I can say is that is always our last resort. Our goal is to identify any risks to that individual and work with them in the least restrictive way possible to reduce or eliminate the risks that are present for them. So that can take the form of in-home services in most cases. So sometimes we get the reputation of being the people who put people in homes.
Exactly.
And that is really the last resort and done when there are no other options available.
Okay, good. Well, thank you. That's all the time we had. I appreciate the information. I hope that we're more aware, unfortunately, of elder abuse and certainly ways to help. So thank you for tuning in to Aging Matters.